Okay, good morning, everybody. Thank you very much for joining us for today's mental health support webinar put on by the Honourable Lisa MacLeod, Ontario's Minister of Heritage, Sport, Tourism and Culture Industries. We want to thank you for joining us here today. My name is Derek Rowland. I'm the Deputy Chief of Staff and Director of Communications to the Honourable Lisa MacLeod, and I'll be acting as the moderator for today's session. Before we begin, I'd just like to remind everyone below that we do have a QA box and function that is operational today. Following today's presentations, we will be taking questions because we've got quite a few people on the call here today. We're going to be using the QA box to answer those questions and reading them out directly. So if you do have a question, feel free to put it down in the box below. And when we get to the QA portion of today's presentation, I will read it out on your behalf. But with that, to begin our presentations today, I'm going to turn it over to Minister MacLeod for introductory remarks. Minister, over to you.
Thank you very much, Derek, and thank you all for joining us here today. We have over 250 people, I think over 300 perhaps, from across our sectors and across the entire province gathering today. I would like to first welcome my colleague from Cabinet, Minister Michael Tibollo, who is our Mental Health and Addictions Minister, and he'll be providing a few remarks in a little bit. We're also joined by Dr. Farrell from the Royal Ottawa Hospital, to talk about relevant mental health research and data. Dr. Tim Simboli from CMHA will provide brief remarks on province-wide initiatives and supports. And Benjamin Lakin from the Ottawa Public Health will be talking about supports that you can access. We'll then go into a Q&A portion where we can answer some of your questions with respect to supports. And if we need to further follow-up, we'll do that as well. It is important, as Derek said, if you have a question, to provide that into the chat box, or you can always email minister.macleod@ontario.ca. We also encourage you to check your inbox after this, because we will be providing the slide presentations to all of you for important mental health research and supports across Ontario. But look, today, I often talk about our double bottom line, what we represent in this ministry for the economy, but also what we do for the cultural fabric of the province of Ontario. But after 11 months of this pandemic, this meeting today is not about sport, culture, heritage, not-for-profits. It's not about any of that. It's about you. We know that our sectors were hit first, hardest, and will take the longest to recover. But today we want to talk about the people behind the sectors, the people that have been shuttered for 11 months, or those who have seen their employment change, or prolonged lockdowns and not being able to see family and friends. Today is really about all of you, and that's why I'm proud to have my colleague from Cabinet to join us today to talk about what our government is doing, but also how we can support you, your family, and your co-workers during this very difficult time. I also just wanted to say it's okay to be on here and not to feel shame. It's actually important that you're here to have this mental health discussion. Mental health is health. It is your healthcare. It is every part of your body and mind and your spirit and your soul. And I think it's really important that we have a very candid conversation and not be afraid and feel shame to speak about it. And, we've talked a little bit about on some of my telephone town halls and webinars about mental health, and Minister Tibollo was good enough to come on a sport meeting with me earlier in the pandemic. But I felt it was really necessary right now that we have this conversation, because we're nearing the 1-year anniversary of COVID-19 shuttering the province. And I remember on those very early days, the uncertainty, the fright, the fear that we all felt. And I still feel that way from time to time myself. And so I just wanted to let you all know that, it is really important that we converse openly about our mental health. And I've never shied away from talking about my own challenges that I faced. And I think it's important that you know that it's okay to ask for help, and it's okay to get help. And so I'm just going to give you a sense of some of the things that I deal with. If you look back at my photos between 2014 and 2016, you'll see a change if you look at my pictures, you'll see a change in my physical appearance. And you can actually see when I was going through episodes of anxiety and depression, I could see it in my face. My family could see it. They're all from Nova Scotia, and they would see me on TV, and they would recognize that I was in a terrible cycle. And, I went for help and I got help. And, it was interesting because some people at the time said, well, you're strong and you're funny and it wouldn't happen to you. It did. It happened to me. And I decided I was going to talk about it because I didn't want, my mental health to be played like a political football. You can also look at another period of time when my hair completely thinned out, when I changed my appearance again. And it was toward the end of my time as social services minister. I was quite sick. And that's when I found myself walking into the psychiatric unit at the Ottawa General Hospital and got some help and got some support. And I've come out of it quite well, but I recognized then I was dealing with some trauma because I had death threats. I had a lot of police protection at the time and I didn't know what was what. And I received support. And to this day, I still receive that support. And it's okay for me to talk about it because I feel that it's my job to let people know that in society, there are some of us that deal with traumas. There are some of us that deal with mood disorders, as I have now, and I'm not afraid to talk about it. And so the whole point of today was to make sure that if you're feeling scared to come forward, you shouldn't. If you're afraid to seek help because you think it will impact your job or your relationship, it won't. And if it does, then there are recourses for you, particularly with respect to mental health supports at your employment. And so I wanted to be very candid with you because I know, and I've walked a mile in those shoes, and I still do. And that's why I wanted to bring everyone here together today to provide that level of support. And I know there have been a few questions that have come in over the past year to the inbox and ask what I'm doing for my mental health. When I know I need that conversation with my mental health support workers, whether that's a psychiatrist or a psychologist, I make that appointment. And I have to be religious in making sure that I follow up with the recommendations that they provide me. And if I can do this, I guarantee you can do this too. So with that, I'm going to send it over to my dear friend and my colleague, someone who is meant for this role as a Minister for Mental Health and Addictions, someone who has a great deal of compassion and experience in this field, and someone I'm proud to call a cabinet colleague and a friend, the Honorable Michael Tibollo, who also, by the way, understands a thing or two about our sectors because he did do a stint here and probably enjoyed it as well. So Minister Tibollo, over to you, and thank you so much.
Thank you, Minister, and Lisa, it is always a pleasure, and I will always stand beside you. You've always been a champion for the people of the province. You worked really hard. I was there through those hard times in that ministry, and I know you were wearing it because you care and you put it your heart and soul into what you were doing. And I think the people who appreciate and understand the effort that ministry needed will always be grateful for the work you did there, and now the great work that you're doing in this ministry. It's truly an honor for me to be here. I had spent not a long time in the Ministry of Tourism, Culture and Sport, but I quickly recognized the significance of that ministry from a financial aspect to the province of Ontario, and just how important the sectors are, not just economically to the province, but sports. And the story I always tell is as part of my work in mental health and addictions, I was invited to a symposium that took place at the Vatican. And I was sitting there with leaders from around the world talking about mental health and addictions and how to combat them in different jurisdictions. And the Pope was there, and he was looking at the list of people that were there. And I happened to be the only Canadian there, but interestingly enough, a minister. So he called me over, and we had a conversation about the importance of sports in impacting on addictions and what we need to do in sports to further build the strengths of resiliency of young people so that we don't have them looking to substances as a way to cope with difficult situations. So, as I always say, there's 16 ministries that I intertwine with as the minister responsible for mental health and addictions. And certainly culture, tourism, sports, heritage are all themes that are extremely important, and mental health plays an important part. As Lisa said, as the minister said, you can't have health without mental health. And I used the example, and I used it earlier today as well, where I attended the funeral of a police officer who committed suicide about 3 years ago when I was in a different portfolio. But I went to the funeral, to the wake, and I saw pictures of this individual that, I would have given my eye teeth to look like him. He was ex-military, OPP officer, extremely accomplished, all kinds of accommodations. But the one thing that was really troubling to me is looking at him, you would never have thought, based on his physique, based on the amount of sports that he was involved with and activities in the pictures that I saw, that he had a problem. Well, if you don't have mental health, you can't have health. And there are many examples, I'm sure, that you could cite as well of situations like that. So for me, when we talk about mental health around the cabinet table, or if we don't talk about it, but there is a thread that runs through a ministry, I make a point of highlighting it, because I think it's extremely important that no matter what we do or what we talk about, if there is something that relates to the mental health of individuals in the province, we have to highlight it and ensure that we're doing everything possible to make those people feel that there is support for them. And the province, when you look at the sectors, I've got many banquet halls in Vaughan Woodbridge, the area that I represent. They were shut down. The hospitality industry was virtually shut down, and they had huge pressures on them. These pressures have had an impact on the mental health of all of them, not only the owners, but all the people that would have been employed in that sector. And that's no different in the tourism industry. I remember when I was looking at, the number of people engaged in tourism and culture and sport in the province, how far and wide the numbers go. And it's every corner of the province, and it includes every component of our population. So Indigenous and Indigenous tourism, the Francophone and the Francophone tourism, and all the other sports and activities that take place that bring all kinds of people to different parts of our province for games and for tournaments. So it impacts everyone, not just, the selected few people. And the stories that I've heard about people that own businesses, small and medium-sized businesses, again, Vaughan Woodbridge is filled with entrepreneurs that have invested their lives in building these businesses. Well, they all hang from a string as well, and are concerned not only about, the future of the people that they work with and their businesses, but their families and their investments. So we've all been struggling, trying to maintain this physical distancing, trying to maintain the hand sanitization and wearing the masks, and this has all led to widespread financial uncertainty that really is impacting all of us. In 2019, the Canadian Mental Health Association noted that 2/3 of small business owners and entrepreneurs felt depressed at least once a week, and nearly half said their mental health challenges interfered with their ability to work. We've seen statistics that 500,000 people prior to the pandemic weren't going to work because of a mental health or addiction issue in Canada. And that's 500,000 people a week. So compound that with what we're seeing with the pandemic, compound that with everything else that's happening. We as a government made it a priority. And I have to say, our premier and the entire cabinet stands behind the work that we're doing with mental health and addictions. Less than a year ago, we started our plan by announcing the Roadmap to Wellness, a plan to build Ontario's mental health and addiction sector. And Minister Elliott and I spoke about it on Ontario Shores. We were really proud about it. And literally a week almost to today, the only questions we got related to, do you think this COVID-19 is really going to be a pandemic? And do you really think we're going to have to start worrying about, mass immunization one day and having to look at, well, here we are a year later and look what we've gone through. But we launched the plan, and it was very timely. We invested and have been investing significant amounts of money. Our commitment was $3.8 billion over 10 years. And we've started significantly investing, 176 million the first year in government, 174 million the second year in government, 194 million specifically to help during the COVID-19. So we're up around $750 million, and we're going to continue investing so that we build a roadmap to wellness from the ground up, a foundational document that's going to be the cornerstone of the future of mental health and addiction treatment in the province of Ontario. The document wasn't built in a vacuum. It wasn't me and Minister Elliott sitting in a room, drawing diagrams and coming up with what we thought it should look like. It was done with extensive consultations with families and people with lived experience, grassroots organizations, frontline health service providers, police. We talked to everyone. Not only did we talk to everyone, we also looked at being culturally sensitive. The LGBTQ2 community, the Black community, the Francophone community. They're all part of Ontario. And yet we've always built one size fits all as the way to look after the people of this province. And that just isn't right. That just doesn't work. We all know that. And I think you all know that. The sector knows that there are differences that we need to take into account if we're truly going to look after the needs and have a client patient centered approach to helping individuals. And we've seen the benefits of doing that, building a system where we match the most appropriate supports so that we can really make a difference in people's lives. And so the investments have been made. We continue to make investments and we continue to consult. There's an additional investment that will be made this year that will, again, augment these services that we're providing, not only to help alleviate capacity pressures experienced throughout Ontario's mental health and addiction system, but to also build education and prevention to our youth by building resiliency. We've also invested in mental health, virtual mental health, and that's something that I do briefly want to talk to you about. That's internet-based cognitive behavioral therapy and virtual supports for healthcare workers. Tourism and sports and culture of individuals from those communities also have access to these systems. You can go online to ontario.ca/mental health, and you'll see access points to these different programs: Bounce Back, ICBT through Morneau Chappelle, ICBT through Mind Beacon. These supports are there. And I can tell you there's over 33,000 people that are now utilizing those online virtual supports to help them. Now, is that going to help everyone? No, it won't. But what we do know is that it will help a large majority of people with depression and anxiety. And we've also implemented a system that I'm really proud of, and that's structured psychotherapy. I actually was at the Royal and have had many discussions with the people there and the great work that they've done in the leadership of bringing forward a structured psychotherapy paid for by OHIP, but providing in-person supports and services. And again, we're over 30,000 people that are taking advantage of those programs. And we've built a system that's going to continue to grow and continue to provide those supports to the people of the province. I have to say, I'm really proud. And if I talk with passion, it's because I know how long we've waited for a system in this province. For 10 years, as part of, I practiced law, but for 10 years, I ran a center for people with mental health and addiction issues. And I can tell you that I saw many people slip through the gaps in the system, not have proper access to the supports that they needed. And that's going to change. That is changing. We're providing better access points, a connected, continuous system of care for individuals so that everyone who needs help can get it. And specifically to your sector, I have to say that there is help there for you. Please utilize the supports that we put in place for you. Most of them are, they're virtual, but there are also in-person supports. Utilize them, and you will see that there's a huge difference in your children. We have supports for them as well, whether it be through our kids helpline that we've invested a tremendous amount of money. And by the way, we've seen just how huge an impact it's had when the school shut down and the kids needed that extra support, that person to talk to. They had access to the kids helpline and it worked really well. Benjamin and I this morning had a conversation just how many people in the Ottawa area alone accessed it. And of course, Kathy Hay in Toronto, I've had many conversations of how useful it's been to help kids as well. I'm going to stop there. Our government is keenly interested, as you can imagine, having appointed a minister responsible for mental health and addiction. And I will advocate on behalf of the people of the province to make sure that we build the best system possible, a modern system that's transformational, that's connected and comprehensive to help everyone in the province, no matter where you are, no matter what you believe in, no matter what your background. The system is here to help absolutely everyone. So thank you so much for having me here today, and I look forward to the speakers that are following. And I say hello to all of them because I know I've met them all, and I've had many conversations with them in their offices, and of course in at Queen's Park as well. So thank you for all the great work you're all doing, and we will get through this together. Thank you.
Thank you very much, Minister MacLeod and Minister Tibollo, for your remarks. We're going to get started with the formal component of today's presentation, beginning with Dr. Susan Farrell, who joins us from the Royal out in Ottawa. We'll just bring up our slide deck here, and then Dr. Farrell, over to you.
Thank you very much, and thank you for the invitation. I'm going to speak very quickly about some of the things that research has told us, because research helps guide our actions. It helps us develop that system that Minister Tibollo spoke about so very well, and to modernize and innovate the system of care that's needed, both to respond to the mental health effects of COVID-19, but broadly to respond to the needs of everyone who lives in Ontario. Believe I'm having help with the slides, so I'll just say next, please. Thank you. So if you look at this, this comes from the roadmap to wellness that Minister Tibollo spoke about. And what it means is that mental health and mental health needs exist all across our province, all across the population. In the general population, they may be lower needs, and my colleagues will speak to some of the wellness initiatives there. The Royal, or the hospital where I'm in, is called an Academic Health Sciences Centre because it sits at levels 4 and 5. That should mean that things like a pandemic don't surprise us. We know what will happen. We know what happens with disasters in mental health. But I have to tell you, as a clinician, as a proud member of Ontario, and as a parent, I've been very surprised over the past year to, in fact, see what we're learning about the mental health effects of COVID, specifically what the research has told us. Next, please. So I'm going to talk ever so quickly about what we know and what we're finding relative to some of the COVID research done by my colleagues. Next, please. There was a study of almost 8,000 Canadians, and over 70% of them live in Ontario. And when they were asked about their health and mental health during the pandemic, it shouldn't surprise us that people spoke about worsening mental health. But those who were already at risk because they had conditions, they had life stressors, things like that, things were even worse. So COVID has worsened the mental health of our communities, but there are particular groups at risk that we need to consider to think about. We see these mental health effects, and you'll hear my colleagues speak about them in people's sleep, in their physical health, as Minister MacLeod spoke about, because it is also mental health, and also in substance use. So I just want you to think about that, because these are all areas that impact on mental health. They impact on us as individuals, on our families, on employers and employees, but also on our communities. We see the effects of COVID across all these different areas. Next, please. So what we learned by doing this research of almost 8,000 people and seeing how things were worsening, not just understanding that they could worsen, but how specifically they were worsening, we knew we needed to develop some new services, ones that specifically address sleep, substance use, and mental health issues, both for those at risk, but also to prevent growing problems, and to have a broader range of support for people so that people who needed timely care in a more intense way could receive it at other parts of the community, but also to be flexible. Minister Tibollo spoke about virtual care options. How do we have those as accessible as possible? And how do those whose needs are worsening or becoming more serious also receive a model of care? Next, please. So what we did as the mental health hospital in the region was we did, like lots of different partner agencies, virtual care. We worked with other hospitals to help with their mental health clients and patients. We developed some specialized clinics as well. One of them was called C-Prompt. Prompt was a model that we had been developing for quick access to care and C stands for COVID. Next, please. We started C-Prompt because we thought that with wave 1 of COVID, services were going to close down, and we wanted to be there for people where partner agencies might have had to close or adjust. Simply put, we wanted to bridge over disruptions in care. Next, please. What we found, however, was that not only were there the mental health clients that we knew in the system, there were many more that we were hearing about. Look at this graph for a moment. What we'll see is that people who are younger, who typically haven't reported serious mental health issues, are now reporting those as well. So simply put, we need to think about younger employees, younger people in our communities, and what we can do as prevention services so that things don't worsen over their life. We saw 20% of people or more with substance use disorders. PTSD stands for post-traumatic stress disorder or serious traumas, and higher moderate risk of suicide. Next, please. What we offered was different than what some other services had been able to offer or what we had offered in the past. Through virtual care, we were able to offer both psychiatric assessment and psychotherapy, which is a type of counseling. We put that together for folks who might need both types of service or combination of service. For that higher group in the triangle, that in the pyramid, the group that needs more specialty level of care. And that's important because we want to support our community agencies who are able to do excellent counseling and community connections. We wanted to offer something additional as well. Next, please. But the most important thing that we found, developing a model to help with the disruptions of COVID for existing mental health clients, was this. Next, please. Over half the people we saw were new mental health clients. That told us that COVID is worsening people's mental health. It told us that people were finally hearing some of the pleas to access care. We were perhaps, hopefully, reducing some of the stigma about receiving care, and people were understanding the message that when we encourage people to get care, we help not only them, but their families, their employers, their ability to be productive in the workplace. Simply put, all of the parts of their life are positively impacted. Next, please. So we intervened here where the arrow is, above moderate need. And what you're going to hear today, and I hope you've continued to hear over time, is mental health is health that affects everyone. That in the general population, there's important interventions to be done all the way up to 5 are highly specialized in intensive care. And when we work together across the province, we can do different things to meet all of those needs, sometimes building new services and sometimes partnering with one another to continue to deliver what is needed. Next, please. So we've continued on with a service called Prompt Care Clinic, which is completely virtual, and that's intentional so that we can try to build on some of the success of structured psychotherapy, as Minister Tibollo spoke about, and other services, to introduce a different model of care again, where a team of people can see people short-term through virtual care. So people can receive medication assessments, psychiatric assessments, as well as psychological services. It used to be when people first had a very serious issue with their mental health, they didn't know where to go except an emergency room. We're trying to reduce the pressures on emergency rooms and hospitals by having a virtual care, team-based approach for those folks who have more than moderate symptoms, severe symptoms that need to be addressed, but also importantly, get people back to work, back to their families, and back to their lives. Next and last, please. And so what do we know most importantly from all of the research? When I sat with my colleagues and we looked at a year of research that we've been doing on the mental health effects of COVID, we saw 4 A's. We need to acknowledge that it's there for most people. It would be highly unusual after this year if we didn't have serious mental health issues from COVID. We need to find different ways to address it. My colleagues are going to speak very well to wellness in just a moment. How do we accommodate people in our lives and ourselves to be able to be in the workplace, to be productive, to be parents and community members, to seek the care that they need because we've accommodated by building the services they need in order to achieve wellness. to encourage yourself and others to seek help. We keep talking about how prevalent it is, but the number of people who need care are not the same as the number who receive it. Let's encourage to make those numbers even. And then finally, to address mental health, to enhance the health of all individuals. Thank you very much.
Thank you very much, Dr. Farrell, for sharing those very keen insights. We appreciate you donating your time to us here today. Without further ado, I'm going to immediately turn it over to Dr. Tim Tibollo with the Canadian Mental Health Association to walk us through his presentation. Dr. Tibollo, over to you.
Thanks, Derek, and thanks, Minister MacLeod and Tibollo. So maybe for a bit of context, I'm Tim Tibollo. I'm a research psychologist by training, and I've worked for 4+ decades in social services and mental health services in Ottawa. So a lot of what I say will be kind of Ottawa centric. I'm currently the executive director of the Canadian Mental Health Association in Ottawa. We're one of 28 CMHAs across the province. We're all a little bit different, but we all deal with mental health issues at various levels. For the Ottawa branch, our primary client population would be people with serious and persistent mental illness and addictions who are homeless and who are experiencing a number of comorbid kinds of issues. So what we've seen, and as Susan has talked about, is the dial has moved towards the more profound end of the mental health continuum. So normally our folks we would be looking at would be ones that have untreated mental illnesses that are really life-altering. But what we've seen is that everybody kind of shifts to this more severe end of the continuum. So my remarks are actually going to be about the folks that would be normally in the more of a mild, moderate, episodic nature. Next slide, please. So how has COVID affected our mental health? And the answer, Susan went through it badly. That's just the fact. It's really hard to imagine anybody, almost anybody in the world, certainly anybody in Canada who hasn't, who this hasn't had a profound effect on. Next slide, please. So what we are experiencing is never been experienced before. You probably have to go back 4 or 5 generations before you see anything on this level of perfusion around the world, this level of impact. So we're not really prepared for something that happens every 100 years, and that's probably what we're going through right now. For those of us that are fortunate enough to have jobs, our work-life balance is totally out of balance. For those of us that care for others, it has been, not only do we worry about ourselves, but we worry about our partners and our children and our parents, and it's become a load that we have to carry, and it's harder to do. The safety habits that we've had to learn over the last 10 months are still unnatural in many ways. I still don't get out of my car and grab my face mask before going into the store. I don't know how many times I've had to walk back and get it. So some of those safety habits are in fact difficult for us to put into effect. And at a time when we're feeling a lot of pressure and our natural reaction is to reach out to other people, family, friends, whatever, we're now told that we have to isolate. So it's actually made it a lot harder, simply from the point of view that we don't have those natural supports in quite the same way that we used to. We don't have abilities to get out and do things like we once could. If you were into athletics or sports, there's a lot of sports people on the call. Those things have been seriously curtailed. So we don't have that much that we can do to get rid of some of those pressures that we would normally experience, and to build not only to get rid of the pressure, but to build our health. And as several people have said, mental health is totally entwined with physical health. Our resilience, even the most resilient people that I know are struggling with this. Everybody has been tested. Everybody is tired. We've been at this for way too long. We've still got a long way to go. It was like starting off thinking you're running a 100-yard dash, then finding out, no, it's a mile, and then you found out, oh, it's a marathon, and then someone said, no, it's actually an ultra marathon, and then they said, there is no end point. Just keep running. the adjustment to the virtual world, these kinds of meetings, has had challenges and limitations. I think the good side of the coin is that we're learning a lot from them. Virtual care is something that we recognize as being much more powerful now and much more convenient. So we're looking at ways of doing that. And this hasn't been a temporary thing. I mean, I think we would have been okay if it had ended as promised by the end of the summer. It didn't. And it's kept going and going and going. So this isn't a temporary situation at all. Next slide. So we're seeing, when we look at the people that we help, that fear and worry is increasing, that there's more impatience, exhaustion, intolerance. Intolerance is a big one, and I even saw some of that in the chats where people are, there's a lot of public nattering at each other. There's more damage in terms of more symptoms. They're more complex, and there's a deeper impact to the problems that we're seeing. Services are tapped out. We were building a service system gradually when COVID hit, and it was dramatically improved, but it wasn't there yet. So when you increase demand and the services aren't quite to where they should be, there's a shortfall there that we're working on resolving, and in some creative ways, and in some, thanks to the government, in some fundamental ways, I think. We're seeing a lot more self-medication, self-soothing. Substance abuse is getting out of hand. We're seeing poor self-care, so bad habits that make things worse, maybe momentary relief but long-term pain. And we're also seeing what I've called health equity issues. So not everybody is impacted the same way. Some people have kept jobs, some people have lost jobs. Some people some of our folks, for example, are not well connected enough to even keep up on the simple healthcare messages. So even though it's been universal, people have been damaged in various ways. So it's not something that everybody's felt the same amount of pain. Some people have felt more than others. And quite naturally, I think our job as a society is to provide more help to the ones who are suffering the more. Next slide, please. So this is just a complex, where the stress is affecting us. And I won't go through all of this, but it's our emotions. We know that if we're stressed, we're edgier, we could be sadder. It changes our behaviors. We get chippy, we snap at people, we withdraw from people. We've seen the physical side of this where we've lost strength and capacity and all those things that go into making our bodies better. And we've seen changes in cognition. So that's how we think. Are we making good decisions? And when you're under stress, you don't always make good decisions. You tend to revert back to some really primitive kinds of reactions, and that affects how we think. Next slide. So I'm going to give you five helpful hints here right now, because the care of us as a society depends on how we care for ourselves as individuals. So one of the first things that we've said is routine. It'll take more effort because you're in isolation, but you can do it. It's advice that we would give to retirees or older folks. Get a routine, get up, get dressed, go down, have breakfast, do it at roughly the same time every day. It'll provide you some structure for the day. Next slide. Be your own news control board. The news, it is so easy to get caught up in the negative news. To my detriment, I became passionately involved in the American political scene and treated it kind of like the Game of Thrones, and I just had to stop. I just had to stop looking at it for a while. So you have to do those sorts of things, is to, don't follow the daily COVID counts unless it's your job to do that, but you don't need to do that. Next slide, please. Don't abandon the things that make you feel good. So whatever you were doing before that fed your soul, made you happy, put a grin on your face, find those things, find ways of doing those again. Next slide. The healthy living that's come through is eating well, sleeping well, staying active, and keeping connected. Those are all things that go into healthy living. When we suffer, those suffer. The way we can address some of the problems that we have in terms of depression, anxiety, mood disorders is by actually trying to live in a more healthy way. That will have a positive impact. The in-play is very interesting. Next slide, please. So social connection and self-care in the age of physical distancing. This has probably been one of the biggest challenges for folks. It's so easy to find yourself 7 days in a row when you haven't left the house, or you haven't had a chance to talk to somebody, or your usual friends and family connections. All of a sudden, a lot of time has gone by and you haven't been able to do that. Maintaining that is really important. I'm going to go to 6 now, next one. So what happens when all those things that you can do and you and your social circle family can do aren't working for you? So that's when you need to turn and you need to get some help from a mental health professional. So it's things like continued changes in sleep, the stuff you've already heard, sleep, appetite, personal relationships, feelings of sadness, your emotional state, even a hesitation to get connected with people. I haven't talked to my brother in 6 weeks. It's really hard for me to pick up the phone and call him right now. So that's a natural kind of pressure on us. The use of substances, I alluded to it earlier, a loss of control over frequency, amounts, binge drinking, smoking, and the negative consequences are happening, but we're not responding to them as we normally would. And that's goes back to some of that cognition stuff, and cravings and feelings that you need to, a compulsive need to use. I would say this last little bit here is really important. You're looking for trends. You're not isolated elements. If you've got one of these things and it's going, if you haven't slept in a week, get some help to sleep, warm milk, get up on time, turn off your blue screens, those sorts of things. If it's short term and it's only one, then you probably aren't in a position where you need to seek out help. But if it's more than one of these, and they've been going on for weeks and weeks, and it really is starting to affect your lifestyle as it currently exists in the times of COVID, then you probably need to seek some professional help. Next slide. So you'll find resources in your community. Primary care is your first one. That's probably the most normal one for you to connect with. I think 95% of the people in Ontario have an established relationship with a GP or a nurse practitioner unit. The healthcare system is where to turn to first. Remember, because some of those symptoms are health symptoms, your body's symptoms, they can actually give you the kind of help that you need moving forward. There are various psychotherapy services, and you'll hear psychotherapy is basically counseling. It's talk therapies. You'll hear it called structured psychotherapy, cognitive behavioral therapy, dialectical behavioral therapy. There's a whole bunch of little different acronyms that go in there, but it's basically talk therapy that will help. And in most cases, talk therapy is proven to be the most effective or one of the most effective ways of dealing with this. So you can look to family service agencies. They're spread across the province. I think there's 48 of them. Community health centers, often that provide basic needs, often have those kinds of supports available. Private counselors, if you look in the yellow pages, you'll see them. If you're an employee, look to your employee assistance program. It's fast and it's paid for. Usually it ends up being 4 to 6 sessions and about a 48-hour connection time. And then there's other online services, and we've alluded to these already. Bounce Back, and in Ottawa, we have a program called Counseling Connects. Next slide. So Bounce Back is a telephone coaching service. It's 24/7, unbelievably. It's one of the things you can access in the middle of the night. You can access it in the language of your choice. I think the last I heard, there were 17 different languages connected with the coaches. There are workbooks and things that can help you work through. Even the website itself will give you some things to look at. Next slide, please. I should say that Bounce Back actually was one of the newer services. It's only been in place for about 2 or 3 years, and it really is a game changer because it gives every single person in the province has access to some kind of coaching for mental health purposes. If you're in Ottawa, you've got Counseling Connect. There's the website. You can get a one-session appointment with a psychotherapist, no questions asked, and you can get right into it. It's turned out to be one of the things that we learned through COVID was this got set up in response to that. Next slide, please. Province-wide, Connex Ontario will give you a listing of all the resources in your area. Crisis Services Canada is an online and phone number that works for suicide prevention. I don't have the latest information on that, but there is, I believe, a one number call that's being set up by the feds. We have distress centers and crisis centers across Ontario. Most major cities have them. This is the way to access them. The suicide prevention line is listed here as well. And for emergencies, you call 911 if things are that bad. Next slide, please. Oh, we're into Ben's slide. Could you go back for a second? The one thing I wanted to say, just as a bit of an editorialization here at the very end, was that I've been giving the same kind of presentation since May of last year. And I can't help thinking that the ball game has changed. And I described earlier how the race has gotten longer. And I think it's time maybe that we looked at some things differently from our own part. I think we need to stop and take stock of where we are, kind of step back from our lives and take a look at them. I think we need to think of the things that we're doing that are good, that have shown strength in times of COVID, and the things that have gone bad. Consider the things you're doing well and actually forget about the ones that aren't going so well for the moment. We really need to reward ourselves for getting through this, a sense of optimism, a sense of pride. Do something different than you've done for the last 10 months, something really small. Don't take up painting, doodle. Do something simple, easy, one step. Don't start a journal. Write down a thought on a napkin someplace. Just doing something different that you may not have done before. Make somebody laugh. Make somebody in your life laugh. The cornier joke, the better it's going to be. I think we spend most of our lives literally hunched over these computers right now. And I think at the end of this session, stand up, stretch, breathe. Pay attention to your breathing. We don't do it well. Our lifestyle is really contrary to good living. And look at the people around you and look at the people who are doing things well that you admire and imitate them. Try to find something that you can pick up from them. And look at the people around you that aren't doing so well and give them a call. Give them a call and offer some help. There's no better source of endorphins in your system than being generous or helping. Overtip. Shovel somebody's laneway if you can. Do what you can to help others, because that has a double payoff. It's a great investment. And I think the last thing is for us to forgive ourselves and to forgive the other people around us, and not to be so bloody critical and worry about how we're doing. We're doing great under the circumstances. I'll stop there. Thanks.
Thank you very much, Dr. Tibollo. Some very helpful tips there, as well as some great resources that you put up in your slide deck there. Before we go to the next presenter, I just want to remind everyone that these slides will be shared with you after the fact. So if you weren't taking notes or if you need to access those resources after this, you will receive them directly. So no reason to worry there. I'm going to immediately move on to Ben Lakin, who is a representative with Ottawa Public Health to go ahead.
Thanks. So I'll get right into it. If you want to hit to the next slide. So we, right from the beginning of the pandemic, we were hearing from businesses, small, large, entrepreneurs, everybody about the different struggles they were facing. And a big part of our work in public health is to promote healthy workplaces. But in particular right now, a big focus is psychological health and safety in the workplace. And so this guide was put together with businesses, large and small, and really encouraging folks to check this out after the fact. But what it's really about is recommendations on how do you protect the workplace, the mental health of those in the workplace. There's a section for essential workers, a section for those working from home, and there's also a section dedicated to those who may have lost their jobs or where businesses have had to shut down. So I really encourage folks to take some time to look at that, really tangible recommendations, things that are based on the national standard for psychological health and safety, and again, built with the business folks in mind and with them. So this is something that has been really helpful here in Ottawa. And the next slide, if we go to that, we got some requests from businesses here in Ottawa and throughout the province. On the next slide, here we go. Just, they said to us, we love the guide, but could you make a little cheat sheet for us? Something that is a little bit quicker. And so what this one here is, we just developed it last week actually for today. And so I'm so glad it's here for you, is how do we support very tangibly, how do we support our staff within our workplaces? Regardless, it does say small business, because we were hearing from small business and entrepreneurs that they were feeling at times left out from some of the larger documents that were out there. So, but this is tangible for everybody. And again, these are tangible steps and some resources at the end that are accessible here in Ottawa and some throughout the province. And then I'll just jump to the last one. Don't want to take up too much time. And the last one is, we're almost there. Next slide. Oh, am I frozen? Oh. Well, the last slide, here it is to support owners specifically. So we heard so much from small business owners and entrepreneurs, how they have to be the rock at all times for themselves, for their families, for their staff. And we really wanted to put emphasis on small business owners need support too. And the best metaphor is, something we use in the caregiver community, and that's you have to put your oxygen mask on first when you're on the airplane, in order to help somebody else. And so this is so true for the owners in our community, the entrepreneurs, the people who take care of us every day. And we need to make sure that they feel comfortable and confident. We need to keep smashing the stigma. It's courageous to reach out. It's compassionate to support yourself and others. And there's nothing wrong with that. So put your oxygen mask on first. And on the next slide is where you can find these resources. And really appreciate anybody sharing these. They're relevant throughout Ontario, throughout the world. Some of the resources at the end are Ottawa specific, but please do share these with your colleagues in the space. As we've heard from others, they can be helpful. Thanks a lot, everyone.
Thank you very much, Ben. I really appreciate you walking everyone through that. I know we are sort of coming up on time here, but if we could maybe steal another few minutes from all of our presenters here, we have received quite a few questions, some of them that are quite specific, which if they are, we regret may not be able to get to your specific question, but we certainly do encourage you to email us directly at minister.macleod@ontario.ca, and we'll be sure to refer you over to either Minister Tibollo's ministry or other applicable ministries to get you the answers you're looking for. But some of the general questions that we're getting, here's a great one from Emmanuel talking about workplace supports, but also for those who are looking for support as a job seeker. So perhaps Dr. Tibollo or Ben, if you want to jump in on this one, it says, I'm wondering what is being done for job seekers who experience mental health and addiction stigma during the job search process, which I'm sure has become very important here in light of the COVID-19, the economic impacts that it's had. Maybe Dr. Tibollo, if I'll throw it over to you first, and then maybe Ben, if you want to jump in.
Gee, thanks. This is a difficult situation. Some of the, because these people are outside the workforce, there's a number of resources that they don't have. Most of the resources that have been set up, if you're in Ottawa, the Counseling Connects or the Bounce Back would be good sources of information. They're free, they're low threshold, which means they're easy to access, and often getting involved someplace in the system is the first step towards getting yourself involved in the right place in the system. So if you start with somebody, they'll do a bit of an assessment and they'll say, no, you're doing really well. Just hearing that, I think, is kind of important. Or they'll say, I got a spot where you should go and get into the queue to get into this kind of service. It may not be readily available, but I think that's what a couple of practical suggestions that I'd make.
Thanks. Ben, do you want to chime in there as well, or?
No, I think I mean it's a really difficult question because of the context. You know, you don't know exactly what the context is, but I think it's important to share honestly resources like the ones I just had up, another resource from the Canadian Mental Health Association, the Royal Mental Health Commission, with these employers. If they felt that there was some discrimination or stigma they faced, to send that and say, and to speak truth to it, to say, you know, I felt a certain way during this process and I wanted to share with you some resources that speak to that. And I think it's important for everybody to, wherever possible, advocate for themselves in a respectful way. And that can make a big difference, because the individual who's doing it might not have known that their behavior was discriminatory or stigmatizing. So it's hard sometimes to stand up for your own rights, but I do encourage folks to use resources like the ones we had to help support you. Thanks.
Thanks. Actually, that dovetails nicely into our next question, talking about standing up for your rights. We've got actually an anonymous submitted question from a representative of the sports organization. Certainly within our portfolio of sectors, we do a lot of nonprofit work and come in contact with a lot of volunteers. And so this is talking about sort of your personal mental health. The question is, for those who are experiencing verbal and threats to individuals who are acting as a volunteer, what can be done to counter this? Are there ways to get assistance for those volunteering? Being abused is one thing, but how do you deal with the abusers as well? I'll open it up to the floor for any of our presenters if they want to speak to that.
You know, I'm gonna say, Tim, Dr. Tibollo talked a little bit about the aggression that was in the chat box. And I think that, you know, as a public official, and maybe Michael would want to talk about it too, you know, we're always willing to put up with scrutiny, as I know most volunteers are, but there are a lot of attacks that do cross the line that can really trigger an individual, because some people actually, in my experience, have been aggressive in order to make other people feel badly, and it's bullying. And we you know, as all of our provincial sport organizations, we have Rowan's Law that makes sure that we understand how to keep our kids safe from concussion. But in all of our provincial sport organizations too, we have been, you know, I'm a parent, a hockey coach, and you know, we took courses before we were able to go behind the bench and with children to talk about anti-bullying behavior and making sure that we were supporting mental health. And so if we have to, as a ministry, become tougher, and with zero, we already have zero tolerance, so this shouldn't be continuing, and that would extend into any workplace, and that would extend into any field. It's not all right to play with someone's mental health because you think you can. And so I wanted to make that point, because it could have really catastrophic consequences. And I think that we all have a role to play, and I'm saying this as a hockey mom right now, but and as your minister, we all have a role to play to make sure that there is a safe environment for our children and for our volunteers in sport, but also for everyone on this call, regardless if you're involved in sport and with other children. You know, playing with people's mental health is not okay. I don't know, Dr. Tibollo or Dr. Farrell, I saw a lot of nods there if you wanted to add anything.
I am the mom of a soccer referee. And what I didn't know when I signed her up was that 2/3 of soccer referees leave in their first season for exactly some of this dynamic. I think you spoke to it very, very well. And I think the first issue is often the abuse and the threats and those sorts of things. They come slowly. Sometimes they're huge, but sometimes they're slow chipping away at our sense of ourself, our competence, or our ability. It's not okay. Minister MacLeod said it beautifully. But the other issue is it's having someone to talk to. If there's something happening that is shaking your sense of yourself, start with your social circle and then move to a professional, get some help. Do not weather things like this on your own.
Maybe I'd chip in and say, you know, the advice is pretty much what we would tell kids in the schoolyard if they're confronted with a bully. You identify that what's being said, the way it's being said, is the problem. You tell people that, you know, if you want to talk to me about something in a reasonable way, I'll listen. And if you don't, I'm walking away, and don't take it as being impolite. I will not put up with this. And I really respect the ministers on this call, because the criticism and the anger is over the top. There are good points there, but it's blanketed in anger, and we can't tolerate that as a society. And it's really easy for people to get angry now about way more things than what they're talking to you about. It's coming from you can't control it. You can only respond to it and then stop the response.
Thank you. Some of the other questions that have.
Minister Tibollo had a point. He was just on mute.
Oh, I'm sorry.
Sorry, actually, I didn't realize that's why I was on mute. So I apologize. I just want to add to that. I completely concur with that. We have a zero tolerance policy when it comes to bullying and when it comes to those types of situations where someone is made to feel less. What we need to do is we need to understand why those situations are occurring and addressing them with education and prevention. Whether it be the workplace or the schoolyard, it's easy for us to relapse into situations where we take out our frustration with words that cut very deep in some cases, because not all of us come from the same cultures or share the same life experiences. And I think the more we can be culturally sensitive to each other, the more we can understand, the easier it becomes to be very, very careful with the words we use and the things we do. So I think that's all part of an education process that we need to invest more in, whether it be through mental health and addictions into the educational system to support it in schools, or through the Ministry of Labor and through the Ministry of Culture and Heritage, where those are the kinds of issues that could very easily be addressed there as a sensitivity issue. I think there's more work that government needs to do, and we have to look at these, because again, the pandemic may not be here, hopefully, in short order, but other issues will arise. So these are bigger societal issues that we need to address, so that we have a strategy, a plan to improve our overall mental wellness in the province of Ontario.
Thank you. And I think maybe we've got time for one last question here. And maybe it's best for Dr. Farrell to answer this one. In light of, obviously, the province has gone through a series of lockdowns and restrictions that are currently in place, including in the healthcare field. The question is, how are we going to be getting the mental health treatment back up and running for in-person services as well? We've talked a lot about virtual services, but looking to the future, I think.
It's a very good question, and we work in close partnership with, in our case, the experts at Ottawa Public Health, but you have public health units all through the province. And the thing that we're always trying to do is match risk and need. There are some people where virtual care is a very good fit. Some people it isn't, and some people cannot afford the technology for virtual care. We were lucky at the start of the pandemic that TELUS donated some phones for a few people, but of course it wasn't for everybody, and there's more need out there than we have supply. So what we try to do is we try to balance the risk of people being together, even if it's services 6 feet apart and masked, versus being able to deliver them in different ways. We know that the province is in different levels of risk and lockdown, and people are watching that very carefully. So we're doing everything we can to offer a stepped approach to coming back together. We realize that there will be some services where we don't come back together the same way for quite some time. And so for people who can do virtual care and are just sort of waiting to get care, thinking I'd rather see someone in person, please try virtual services if you can. Try the phone, try this sort of method, because most people tell us that when they do have access to technology, it's much more helpful to have received services in real time than to wait for when we're all back together.
Very good points. Thank you very much for that, Dr. Farrell, as well as Dr. Simboli and Mr. Lakin for joining us here. Before we depart, I'll turn it back to Minister MacLeod and Minister Tibollo for any closing remarks.
Sure, I'll turn it over to Minister Tibollo if he has anything that he'd like to say, and then I'll just make a short conclusion.
I just want to say thank you. I've had the pleasure of meeting and speaking to the doctors on the line and Ben this morning. The presentations were excellent. Thank you for doing what you've done today, because again, I think the more we share, the stronger we become. And Lisa, to you, thank you for thinking about mental health in the sector of tourism, culture, and sport. Very, very important. And you know, I'm glad to call you a colleague. I'm glad to call you a friend, and I appreciate the thought that you put into putting this together. So thank you as well.
Thank you very much, Michael. I'm extremely grateful that you made time today, and I know we went over time, so I just wanted to say thank you to all of the panelists. Dr. Farrell, I've been working with the Royal for many years. I really love working with you, and Benjamin. Of course, I'm meeting with Vera every week, and I'm really grateful that you were able to come on. And Dr. Simboli, I thought you know, your presentation said something to me, and it was about the changing goalposts. You know, this is the Ministry of Sport, right? And you said that we started off as a sprint, then it was a marathon, then it was an ultra marathon, and now, you know, there's no end in sight. And I think that level of uncertainty is what really creates a lot of anxiety for people, which then can, I think, you know, lead to into depression, which is how things worked with me. But I want to really reiterate the point about workplace safety and the volunteer aspect of the safety there. We all do have a role to play in calling out that behavior. And it is not fun to be on the other side of that and to be receiving that because, and they may be having some challenges themselves. And so I know we want to be compassionate with everyone, but I think also we have to make sure that we are not only just offering a physically safe environment, but also a mental health safe environment. And I thought that was really helpful today. So look, again, please continue to send questions in if you have any, and we will make sure that this presentation is made available. And if it's required, and this seems to be going on for another 6 months, we'll strike up another conversation. But let's not just have that conversation one day a year in January. Let's have it every day. And if you're feeling you need help, ask for it. It's there, and you know, no one will shame you. And if they do, that speaks more about the people who don't appreciate this as being a real healthcare concern. So with that, thank you all so much from the depth of my heart for being able to put this on for my suite of sectors that have been, as I always say, hit first, hardest, and will take the longest to recover. So thank you all, and be well.
Thank you, everyone.